Wendy Waters is an artist who lives in Saskatoon. A few years ago, she was diagnosed with chronic obstructive pulmonary disease, or COPD. She was already in the Saskatoon Health Region's LiveWell chronic disease program when she was asked to take part in a remote patient monitoring program, known in some parts of the country as Telehomecare. Every day, she used the supplied equipment to check her blood pressure, heart rate, and oxygen levels, and send the results electronically to nurses in another location.
I think it was really comforting knowing that how I was feeling, or that day, like good or bad, that someone was glancing at it and that knew if it was something that I should be kind of paying attention to. And I think that was the best part. Plus I felt more in control of my life because I was checking my heart rate and my oxygen and my blood pressure.
2 nurses monitored the results sent in by Wendy and the other patients. If they saw anything to indicate a serious problem, they contacted patients immediately. They say monitoring patients remotely with Telehomecare has a lot of benefits.
And for us then as healthcare providers, it really improved our efficiency. So we were able to follow up with a lot more patients each day than we would normally if we were going out for home visits.
And it really allowed us to connect with a broader scope of patients that live in rural areas that we just didn't have the opportunity to have that connection, that relationship with, and then we really could with this.
The program was well received by the patients. More than 90% said they were extremely satisfied with all aspects of it.
I think the real value for people with COPD of remote patient monitoring is the proactive and timely nature of the interventions we're able to implement as soon as we can see that somebody's deteriorating. The second thing is that people really become, I think, a lot more empowered, and they're able to have a lot more confidence in their own abilities to manage their conditions.
The Saskatoon Health Region's LiveWell program has been in place for many years. The addition of remote patient monitoring for COPD patients has shown that it can extend its reach and benefit even more patients.
We've learned from this program that technology by itself, in isolation, is really just a lonely piece of equipment. But when that technology, in this case the remote patient monitoring, is partnered with an effective expert team that delivers goal-oriented chronic disease management, it can seamlessly integrate the care that patients receive.
Wendy Waters agrees. She has gone from being a self-described couch potato to being much more active and enjoying life again.
It's a godsend. It really is. I just can't stress enough to anybody, like, if you have the opportunity to be on the program, go for it. You'll live better, you'll be happier. I just can't see that not being what happens.